Hello, everybody. I am Tiffany. This is Ezra. In case you don't know us and you're seeing this, he's sleepy. He just had some milk, so he may let out a burp. So anyway, Ezra is 4 months tomorrow. It's so exciting, but kind of like bittersweet because time is just flying by and I want him to stay little forever and ever. Anyway, so I just wanted to give a little background on his surgery. So as most of you know, he was born with something called anorectal malformation, otherwise known as imperforate anus. So it's basically where the colon and the rectum don't connect. So basically where most of us have a regular, for lack of a better term, butthole, he doesn't. When you see, down in his butt, it looks like there's kind of a butthole there. He has basically like the sphincter that, tightens when you go to the bathroom. He has all that, but it's closed. There's like a flap of skin over it. So when he goes to when they did surgery 2 days after birth, they had to put in an ostomy. And that is basically where he has to go to the bathroom into a bag. So you've probably seen, people with colostomy bags. So it's basically kind of the same thing, but for a baby. So they had a baby-sized one. And then they also made a fistula. And the fistula is basically there to let the doctors know kind of where they needed to go when they have surgery, for not to get like all clinical. So, and I have been doing a lot of research and reading about it, and it's also complicated medical terminology wise. And so I'm still trying to figure it all out. But, so the 2 days after his surgery, he had the ostomy put in, and that's how he's been defecating. So when he has his surgery in a couple of weeks, it'll be December 13th at Nicholas Children's Hospital. When he has that surgery, they will be basically forming a rectum for him. So your rectum is basically the tube that connects to the intestines, that helps the poo come out of your body. And he doesn't have that connection. So they're going to be forming that and basically giving him like a little butthole. So that's the first surgery. They will keep the ostomy on to let his booty heal and the rectum heal and all that. And then about 2 months after that surgery, so when he's about 6 months old, they will be closing up the ostomy and connecting everything so that he can go to the bathroom normally. And I say normally loosely because I think people that have had these issues, it can be lifelong issues. Really depends on the age of their surgery, how serious it is. There are several different types. When we saw the doctor, we're seeing Dr. Juan Callisto, and he's fantastic. When we saw the doctor, he explained that there are several different types of surgery. I want to say he mentioned 4 or 5, but I was so tired that day that I don't remember exactly how many he mentioned, but he explained that to us, and he said that Ezra's is the second easiest, that it's pretty straightforward, and it's also called a PSARP surgery, P-S-A-R-P, if you want to look it up. It's a long word, and I couldn't even possibly begin to pronounce it. Anyway, so when he gets, the 6 months surgery, that should fix the problem. Now, that doesn't mean that it'll be over. He will be needing to follow up with the hospital until he is 3 or 4 or 5 years old, maybe. So it will be lots of traveling to Miami. Dr. Callisto wants to follow up with him directly, which we appreciate. We didn't want to have to send him to some other doctor who wasn't familiar with him particularly, or who didn't do his surgery. So we appreciate the fact that we're going to do that, but it means traveling to Miami a lot. That is mainly the reason why we're doing the GoFundMe. I know a lot of you have sent gifts through baby shower, and we so appreciate it. We do not want anybody to feel obligated to give. The most important thing right now is sharing the GoFundMe. That can help a lot. That can help a lot. Even if someone was able to share and it got to somebody else down the line and they were able to give $1. I mean, that's $1 less of traveling expenses that we have to pay, or any kind of medical expenses right now, fortunately. And I never thought I'd say fortunately about this, but he has Medicaid. It's fantastic for kids because it covers things 100%. He is completely 100% covered with the surgery. We are so blessed and grateful for that. I don't know what we'd do if he wasn't. So the GoFundMe isn't necessarily for any of his direct medical expenses as far as like his surgery or anything like that. He doesn't have like co-pays. Anything that he may need that insurance wouldn't cover. So far right now, insurance is covering all of his ostomy supplies. They don't cover things like, at least I don't think so. We've tried so hard to get answers from Medicaid, and it's aggravating. So if anybody's hearing this and knows if they cover supplies like gauze, paper tape, things like that, let us know. They do cover certain silicone tapes for his ostomy. They cover his bags. They cover all of the expensive, really expensive supplies, but we do need to use gauze. Sometimes we use diapers when he has a leak, or when we're taking the ostomy off and getting him ready for his bath, we'll put a diaper around it. So it's these little expenses that have to do with the ostomy and not just kind of like regular baby stuff, I guess. Another thing that we are going to have to do is something called dilation. So basically, when they make his, when they form the rectum that goes out of the anus, they're going to have to dilate that so that he can learn to use it properly. They're going to do dilation, and that will help stretch that muscle and that area in the booty, and that is going to be something that we're going to have to do 10 minutes a day, twice a day. We're also talking to a lot of other moms and dads whose babies have been through this, and they've been amazing. The support we've gotten through the Facebook community groups have been wonderful. I just posted the other day about how I was just so afraid of how much pain he would be in, and a lot of other moms, and it was in a mom group, a lot of other moms really helped me feel better, because I was just so afraid for that. In the beginning, he's going to have to follow up weekly, I think. And then as he grows and more time in between follow-ups, it'll be like monthly or something like that. But it will be for the next several years. His insurance pays 50 cents a gallon on gas, I believe is what it said. Last time, it was our first time using the insurance situation. We got the doctor to sign our paper. We wrote down everything we needed. We called the insurance, asked them what we needed to do. They said we needed a trip number. We tried to get it, and they said, oh, well, you needed the trip number prior to your trip, not after your trip, so we can't cover it. So that's frustrating, but at least it was only the first time, and we can get it, every other time. I did check with his insurance. We checked in comparing all the insurances that were available to him through the state, and this one seems to cover the most as far as, what he needs specifically. So we stayed with that one, because some insurances do cover travel expenses. They do give you like food allowances or food vouchers or something. His particular does not. Since we will be spending a lot of money on gas, we decided to stick with this because it does cover gas. But fortunately, fortunately, it's covering his surgery, and that's the biggest thing. When he was in the NICU, he was there for about 5 weeks. I think it was like 34 or 37 days. I can't remember the exact amount of days. 34 sticks in my head, but I don't know. He was there for 5 weeks. The hospital had trouble figuring out what to bill. So they billed my insurance for his NICU stay and everything I needed there. And that bill came, and my insurance denied it, and that bill came to us, and it was over $400,000. And when Eric and I saw that picture, oh man, we took a picture of it because it was just insane. When Eric and I saw that, we started laughing because, I mean, Eric knew it wasn't a joke, but I was just in shock. I was like, that has to be a joke. And the thing about it is it's not funny really in reality, because some people have to pay that. And it's almost making me cry. Some people have to pay that, and it's like, that's insane, you know? I mean, I would pay, you know, $1 trillion to get him the health care, get him the health, you know, the help he needs and the care he needs medically. But fortunately, we called the hospital, told them that they needed to bill it correctly under his insurance, because that's what they needed to use, and you know, it's being billed through Medicaid, and they're going to pay that. We'll be covered under Medicaid until he's 3, I believe. Being that he has Down syndrome, I don't know if that is different or kind of how that works. We're still trying to get all the info on that. Insurances are so aggravating to deal with. I'm sure a lot of you know that if you've worked in the medical community, or if you have a child, or if you're a human with needs to go to the doctor, then you know, if you're just a human being, it's so frustrating. Anyway, so that's basically what the GoFundMe funds are going towards. Travel expenses, you know, covering the gas that Medicaid doesn't cover, food, and lodging, basically where we're going to stay. Now, as far as lodging is concerned, oh, sorry guys. There are some different options that we are looking into, or that we've looked into. When he was in the NICU, we stayed at a Ronald McDonald house, and they are phenomenal. If you know anybody who is asking about one, or if you are thinking you might have to stay in one, do not hesitate. They are beyond phenomenal. We had no issues with them. And we got right in. It was amazing. We stayed there for a month, and it was just a fantastic experience. The lovely thing about Ronald McDonald houses is they cover everything that you possibly need. All you need to do is worry about your baby. They covered meals. They had laundry facilities. They had different kinds of activities. Like they had like a pet therapy night. It was great. And they have a lot of people volunteering for them that were amazing. Everybody was so nice. He's falling asleep and rolling off my chest. So we did call Ronald McDonald. They are unfortunately 20 miles away from the hospital. This hospital, the one in Advent Health Orlando, is where he was being taken care of in the NICU. And when we stayed at Ronald McDonald there, they were within walking distance. So it was so wonderful. In Miami, there's only one Ronald McDonald in Miami, which blows my mind, because there's like 3 in Orlando, I think, or something like that. And it's like 20 miles away from this particular hospital. So it makes it a little bit difficult, because while he's going to be in the hospital admitted for about 5 days to a week, 5 to 7 days is what the doctor said. You know, while he's there, if there's some kind of emergency, we don't want it to take us 40 minutes to get across town in Miami, traffic and everything. So what we're basically trying to do is stay at the lodging provided by the hospital. They have 2 different options. They have something called their Devonshire apartments, and then they also have a hotel that they've done, that they've had a partnership with, who gives them hotel rooms free of charge for them, and then that allows patients to stay there. The hotel, they only allow 1 to 4 nights for you to stay. The apartments it's kind of unlimited, but it's similar to Ronald McDonald in that it's first come, first serve. You can't make reservations with it. As of right now, today is December 3rd, and his surgery is in 10 days. As of right now, they are full. They have no availability. That is what we're trying to get into first, because that's 2 blocks from the hospital. So that way, while he's admitted, if there are any emergencies, we can, you know, run there if we have to. We can just jump in the car and go, and we're really close. The next option after that would be to stay the first 4 days in the hotel, or at Ronald McDonald. But like I said, Ronald McDonald is full as well, and they're very, very much last minute, and or like first come, first serve, I guess I should say. So we would basically be able to check with them at the soonest, maybe like 2 days prior to be able to get in. And that's difficult just because it's Miami, and it's like, if we can't get into Ronald McDonald or the apartments, then we have to make a hotel reservation, and it's the holidays. It's going to be mid-December, so it's going to be crazy busy, crazy full. So the hospital did give us a big long list of hotels that provide discounts. The ones that are closest to the hospital are the most expensive. We're really trying to stay as close to the hospital as we can, at least while he's admitted. When we do have to stay there for 2 weeks because he needs to have follow-ups, and it's much better for us to be in Miami to do those follow-ups after surgery. But, you know, the lodging is the big thing right now. And then, of course, food. We don't want to eat out all day long. We want lodging where we can prepare our own food to save on money and to not just eat junk all the time. Also, we don't want to be taking EZRA out and about to get, you know, to go to restaurants or anything after his surgery. We want to keep him in pretty much 24/7 so that we don't expose him to anything like COVID or RSV or the flu or even just a common cold. So yeah, that's kind of where we're at as far as kind of what the GoFundMe is about. As time goes on, you know, our needs may change as far as what the funds will go to, but we'll always keep everybody updated on that. I never even knew that this was like a thing. Like I don't know. It never crossed my mind that someone couldn't have, you know, that their body couldn't perform like the rest of us. I don't know. I know that sounds so naive and ignorant, but it just, I guess when you don't have those issues, you don't know anybody with issues, it just doesn't affect your life. But it's definitely affected ours. He's just amazing. I really wish he was awake so you could see his face, but he's sleeping. This morning, he had a rough morning already. This morning, after he had his breakfast, his formula, oh, excuse me, my second cup of coffee is over here. I'm looking at it. After he had his formula, his ostomy bag came off, and that's a really stressful experience for him because we have to take the tape off his skin, we have to take the bag off his skin and wash it up, and then we have to give him a bath. And he doesn't hate the bath. He just gets really anxious, and sometimes he gets so anxious it's almost like he's panicking, and it's just heart-wrenching. And so after that, I usually just rock him a little bit and let him sleep because he just gets so stressed out. He does have to have a COVID test, which I had a COVID test when I had my gallbladder taken out, and it feels like they are like putting a Q-tip up into your brain. It's just the most uncomfortable experience. So I'm not looking forward to that. We have to do that right before the surgery, so I'm dreading that completely. Gosh, I'm all over the place, but that's how I roll. Oh, he did have a renal ultrasound the other day. It went well. They did that to check fluid on his kidneys. So when he was, when I was pregnant, they did an anatomy scan. So they do a really in-depth look. Some women get just one anatomy scan at like 20 weeks. I got 3, I think, as he was developing, because they did find fluid on his kidneys at that point. So they wanted to continue to do more. I think I got 2 and I was supposed to get a 3rd, but then he decided to come into the world. So Never did get that third, but he did have an ultrasound after birth on the kidneys and bladder. Looked okay. And then the doctor wanted him to have another one as when he got a little bit older, and the surgeon got those results and said everything looks fine. So that's not going to be a complication. So that is fantastic. Prayers are definitely answered for that. And all of his other testing that he got done, he got a spinal ultrasound at the hospital last week. Or I guess it was this week. It was Monday. That went really well. They were checking for a tethered cord, which, my hand is going numb, which, from what the doctor explained and what the tech explained, that's to basically make sure that the nerves and everything are where they need to be, so it won't be as complicated of a surgery, because everything is kind of connected. When you're, say, paralyzed, spinal paralysis, depending on where you're paralyzed, that affects your nerve. If he had some issues with those nerves, it would have been a little more complicated surgery, but he doesn't. His spinal ultrasound went perfectly. He also had a barium enema, which they basically put the barium solution through the ostomy. Normally they would put it through the booty for somebody, but since he doesn't really have a booty, they put it through the ostomy, just to make sure, just to basically check where everything was connecting, so that they could see where that connection was. The doctor performed it himself, which is fantastic. He likes to perform them himself so that, you know, he's the one doing the surgery, so he needs to know what he's looking at. So that was great. That was wonderful. He says recovery should be 5 to 7 days, typical, if there are no complications. Pain relief after that, he said, is normally controlled by just Tylenol. I did read where other people said that they gave their babies morphine. Either way, as long as he is not in pain, we're good. Fortunately, Nicholas allows parents to stay with the patient at all times. So he is to be admitted the night prior to surgery. So we're going to stay with him that night, or, you know, if we have a hotel or something, we'll check in a hotel and come back to the hospital and stay all night with him prior to surgery. We'll probably stay all night with him the night he has surgery. And then depending on how he's recovering and how things are going, then we will take some time to stay with him most of the time, like we did at the NICU. We were there morning till night, and we basically only went back to Ronald McDonald to eat and sleep and take a shower occasionally. And that's what we'll do this time. I want to thank everybody for sharing the GoFundMe. I want to thank everybody, especially in the EZRA group, for just praying for us and sending us good vibes, and family members talked me through a lot of things, because this is difficult. It's hard. When I had him, I never imagined to love someone the way that I love him. I mean, it's a different love, but it is like you'll throw yourself in front of a mountain lion to save your kid. I mean, that's how it feels. It's that mama bear, protective. You know, I just want him to be happy and protected and safe. It's definitely been interesting, and we're willing to do whatever we possibly can for him. We don't particularly love asking people for help, but, you know, it's not about us. It's about him. So we got to put our pride aside, and it takes a village. You know, it really does. You have to rely on your friends and family, and then when other people need your help, you step up and you help them. Because I'm sure if you look around and you're on the news, you're looking on the news and all that, the world is not in a good place as far as, you know, kindness and tolerance and love and stuff like that. If you guys have any questions regarding his surgery, regarding the GoFundMe, regarding anything at all, we are absolutely open to any questions about Down syndrome, about his surgery. Please don't feel awkward or reluctant to ask us questions, because we're totally open to all that. We want to educate everybody and let them know what's going on. And let me see if I can get his face while he's sleeping. He's sleeping. Okay, well there he is, and we will update you guys every step of the way, and I'll try to do more videos because I know that like you probably want to actually see in action who you're supporting, even though he's asleep. Okay, love you guys. Thank you so much for your support, your prayers, your shares, your good vibes, and your thoughts. I really appreciate that. We'll see you later.
Bye.